was recruited to MD Anderson Cancer Center, where I started making immunotherapy biologics for cancer. 5 years later, they actually used a combination protocol of the immunotherapy that I invented to treat me. And today I'm sitting with you 7 years cancer-free. Yeah. I gave up all sugar out of my diet because sugar feeds cancer. It's not a conspiracy theory. It is a very well-established truth. I love chocolate. And so back then when I gave up sugar and I was clean for 2 years, like no sweets at all, we ran clinical-like trials on 384 people, diabetics and non-diabetics. Every single one had a few points reduction in their blood sugar eating our chocolate.
Actually making it better. Welcome to Beauty Unveiled. I'm Dr. Angela Sturm, and here we reveal the truth behind medicine, plastic surgery, looking good and feeling good from the inside out. Today, I have the impressive Dr. Beata Lerman, who was a researcher at MD Anderson, invented and patented 2 different immunotherapy drugs, was cured of her own cancer with her own immunotherapy drug, and then used her passion for chocolate to invent a sugar-free chocolate that is actually healthy for you. So we'll dive into her background, what brought her to this place to become this amazing entrepreneur. Tell me about you first. Like, where are you from? Tell me about your training.
Well, first of all, thank you so much for inviting me. This looks lovely. I am so excited to continue our conversation from Speak Past. I was born in Russia, in the mountains of Caucasus, which is in the south, bordering current country of Georgia. And I came to the United States in 1998 as a refugee from war. I started my undergrad here at the University of Houston. At the same time, I was working at UT Health Science Center medical school building. If you went to medical school here, you would know that really well.
Yeah,
the
it
one
was
on
UT
Penn.
Houston then.
Yes, it was UT Houston, exactly.
Yeah. And now it's McGovern. Which sounds so weird to me, but yes.
Exactly. So from there, I went on to Baylor College of Medicine, and I worked there in immunology and biochemistry for about almost 4 years. And then once I graduated my undergrad with biology and psychology double major, my dream was to learn how to make gene therapies for incurable genetic diseases. And so back then, gene therapy was banned here in the United States following that very infamous adenoviral clinical trials when 2 patients died. And so I went overseas to get my PhD in biochemistry and genetic engineering.
Where did you go?
I went to Tel Aviv University.
Oh, okay, yeah.
And that was one of the places where gene therapy was right smack front and center to really cure those diseases like cystic fibrosis and sickle cell anemia and Tay-Sachs. Those are rare diseases, but they're still prevalent in the population. And we did, actually we discovered the system that was a precursor to CRISPR-Cas9. So CRISPR-Cas9 happened because in my lab, me and my colleagues took an enzyme out of bacteriophage, the viruses that infect bacteria, and were able to adapt it to replace defective genes in human genome. And then they started screening all of those other bacteriophages, bacterial viruses, and they found CRISPR, which is also an enzyme that facilitates the replacement in the places that is Cas9. That's the name of the site on the genome. So after that, I came back to the United States and was recruited to MD Anderson Cancer Center, Department of Lymphoma Myeloma, where I started making immunotherapy biologics for cancer. And I later decided to enroll into another graduate program there. Got my PhD in lymphoma myeloma. As you mentioned, with the 2 cancer immunotherapies, which we took through clinical trials and patented, published in Nature Medicine.
That's huge. Like, I don't know if people realize like that is a huge deal. 2 of them.
Yes.
So how long did that process take?
About 1.5 years process, which is next to nothing considering how long some of those projects go.
Yeah.
The more difficult part was actually publishing it, addressing all of the revisions and additional tests. And then we couldn't publish before patenting it because you know how bureaucracy works. There is like a very specific chain of events. It has to be secret until it's patented, and then you can publish it because you can't do it otherwise.
Because if you published it and then that's out there for everybody,
exactly,
and you haven't protected your
exactly. Well, I it was more MD Anderson that cared deeply about it, because anything you invent within an academic institution, the academic institution owns the majority of the patent. So over 70% of the patent belongs to MD Anderson.
Yeah. Yeah. I guess, like you said, bureaucracy.
But you know, this is how I see myself. I see myself as an inventor and somebody who is very passionate about solving health problems. Yes, it was ironic that when I was diagnosed with cutaneous T-cell lymphoma 5 years later, they actually used a combination protocol of the immunotherapy that I invented. In combination with adaptive T-cell transfer to treat me, and today I'm sitting with you 7 years cancer-free.
Yeah, yay! That's amazing, because that story is so interesting, because usually it's the other way around. Something happened and then I really wanted to, research this, and so that was the way it was supposed to happen. You made it so it could help you and many other people.
Exactly.
Yeah. So how did they diagnose you?
Well, actually, I diagnosed myself.
Oh,
So it started with something very strange, and I didn't think it was oncology related at all. It started with me having an unbreakable fever, just running fever for 2 months that no Tylenol, no other fever medication could reduce. And, I started having sore throat. My lymph nodes were expanding, contracting. That was kind of an indication. But back then I was thinking some kind of really weird respiratory viruses, because I couldn't really talk. I was coughing all the time. Like I felt like my throat was being obstructed. But so I was just living with fever for 2 months. Traveling. Yeah, I know. It was really strange, because I couldn't even sleep in the same room when we were traveling with my family, because I was coughing so much I would wake them up in the middle of the night. And one day when we already got back here, I woke up and my entire arms, my back, my entire upper body was covered with this small white raised tumors.
Oh, wow.
And I was like, I looked at myself and I said, this is no virus. So I went to my PhD supervisory committee, all of which are brilliant MD PhDs in my department. And I said, hey, this looks like that. And so they got me to, I don't remember her name now, but she's one of the top experts on T-cell lymphoma, and got diagnosed. And we decided to use my treatment that was still finishing up the clinical trials as an experimental protocol, first line.
So you got to try it out.
I've got to seen it, other people trying it out, but I didn't lose any hair. I never was treated with chemo and radiation. So it was huge. It was an interesting time.
Yeah. So did you see other physicians in that time when you had the fever? Were you seeing other people, like going to the doctor?
I did actually.
What did they tell you?
Same thing that I was thinking, that it's some kind of virus and there's nothing really you can do. Here is a spray for your throat. Here is this for this.
Yeah.
So, I mean, we were managing symptoms as we would normally if I didn't, if that third symptom was not raising suspicion in me that, now this goes completely into the other direction, and everything else made sense, because in cancer, you do have this expansion and shrinkage of the draining lymph nodes, which were the thoracic and the ones under armpits for me. So I am missing some of them. So they did cut out some of the more affected ones.
Yeah.
And that doesn't affect my quality of life now.
Yeah. Well, that's wonderful.
But but in order to support that treatment, of course, I gave up all sugar out of my diet, because sugar feeds cancer. It's not a conspiracy theory. It is a very well established truth, because cancer cells are so, I guess the good term for it, so regular people can understand, so messed up that they cannot get energy the same way all other cells can get energy. They default to the very ancient mechanism of fermentation to get its energy. So it has to be hypoxic. Clearly, in every tumor, there is a hypoxic core, and that's they get fed by the only thing that they can ferment, which is in our diet is sugar and glutamic acid. And glutamic acid is an amino acid that is one of the 7 that is very necessary for us to get with food. But sugar is not, in fact, very necessary. And so I've been on medical ketogenic lifestyle for the last 7 years. And I can tell you it's actually the most liberating kind of dieting lifestyle that I found for myself. It's really great.
So did you determine this diet, or did they say, hey, we want to put you on this?
No, nobody said. It's still not very popular, as you well know. When we are in the medical school, at best we get 12 hours of nutrition.
Maybe, exactly.
At best.
Yeah. And so you did the research, you said, okay, this is the diet that I'm going to go on. And
well, I needed to starve the cancer completely, even though immunotherapy really is amazing in the way that it activates the immune system against every last cancer cell in your body. It doesn't guarantee you that if you're not going to continue doing assaults on the immune system through all this unclean foods, ultra-processed foods, the chemicals that don't belong in our body, that it would not come back with the vengeance. And usually, many people know when cancer recurs, it really does come with the vengeance.
Yeah.
It comes back stronger, more resilient, is less less prone to like chemotherapy and radiation, and that tends to be the end of it. This is why we always measure things in 5-year survival. Right. But in reality, what is 5 years?
Right.
It's next to nothing.
I know. In a lifetime, it's so fast. So
like so my daughter was 1 year and 3 months old when I was diagnosed. Like, if you imagine measuring that in 5-year survival, there was a huge chance that I wouldn't see her turning 6.
And that's so scary. Just, you have this basically brand new baby, a year, but basically, that's a scary thought. But you're here, and we're
and I am in fact cancer free. I just did my annual comprehensive cancer diagnostic with all of the MRIs and all of the scopies that you can imagine, and I'm actually much more metabolically healthy now than I was 8 years ago when I was diagnosed.
Just because you're more aware, you're on this diet,
I avoid other chemicals that are toxic. Like, I choose my cosmetics very carefully. I choose the foods I eat very carefully. I choose the detergents that I wash dishes with and clothes. Clothes itself. So we are using only like natural cottons and silks and like not polyester.
Yeah.
Because those are endocrine disruptors. The clothes itself and usually the coating that they put on the clothes can be endocrine disruptors that would lead to a background inflammation that can lead to cancer. Yeah. So all of those things matter. It's not just one thing. It's not just, oh, let's vilify sugar and everything's going to be fine.
Yeah. How did you start all of that? Were you like, this is it, this is scary, I'm going to change everything? Or did you change one thing and then the next thing? And
no,
then,
I quit cold turkey.
Yeah.
I quit cold turkey, and the withdrawal was brutal. I'm going to tell that to your audience. Anybody who wants, who's out there, wants to quit sugar and wants to do it with their family members, don't ever do it together.
Oh, really?
It's gonna end very poorly. Select who goes first, the other one supports, and then once the first one is out of the woods, then they can support the second one, because
that's good advice.
it is at least 3 weeks of absolute miserable. It's if I go back to my psychology days at University of Houston, and I did psychology, abnormal psychology, so psychology of the disease. So I would see a lot of addicts in like my practical days, and I can completely relate that it's like getting off drugs, like getting off cocaine or heroin or something. Sugar does have that much control over our body, over our reward system. So that entire system needs to be rebooted. Yeah.
People do not think about it that way at all, that it is an addiction and you're...
But in science, it's very well described, actually, in scientific literature. I think there was a very famous experiment on rats that everybody keeps defaulting to, that the rats were giving, I don't remember which drug it was, but it might have been cocaine and water and sugar and water. Yeah. And they had to press the lever to get the substance, and they would opt for sugar and water.
The sugar over? Because it's that addicting to your brain.
It's that addictive, and it gives that much more pleasure response. And plus it's legal, right?
And it's legal, so you feel like, oh, this isn't so bad, like, oh, no big deal, a little sugar here or there. Because you can definitely tell whenever you're like, okay, I'm going to do this and I'm going to get off of it, and then you slip up a little bit, it's like slippery slope.
Yeah, it's like, well, today was not good, and let's me start from next week. And
I'll start back on Monday. And you're like,
no, and as I said, like, I've had all of the withdrawal symptoms, mood swings, wallowing in self-pity, like saying why, like, this is not worth it. But still, the picture in front of my eyes was, am I gonna be there for my daughter?
Yeah.
Or am I gonna like have to fight cancer until it's only a one-way battle, really?
Yeah, to live this healthy life, or to
exactly
to have that.
But I'm a chocoholic. Everybody knows that. I love chocolate, and so back then when I gave up sugar and I was clean for about 2 years, like no sweets at all. I started to create recipes just in my own kitchen, recipes that would be keto-friendly, metabolically healthy sweets. Well, I thought, somebody already invented clean, good-tasting chocolate that I could eat that would not be glycemic, and boy, was I wrong. So no, people have tried, and I mean, we all know like Lily's and Unreal and things like that. And so I've tried them all, and they were either just really horrible tasting. It's either cardboard or it's overly sweet. Because when you try to replace sugar with even natural, healthy sugar alternatives, you need to understand their behavior, how molecules behave. Because otherwise it's very easy to mess it up. I went as far as finding different vendors on Etsy and Amazon where they would have this box of 4, completely unimpressive looking truffles, which would be $5 a piece. So it would be $20 per box of 4.
Yeah.
And one bite and they would end up in the trash because it would just be too much.
Yeah.
Too much. And then my daughter, she was already like 3.5 or 4, and maybe it was Halloween, by the way. It might be. It sounds about right as far as we're filming this on Halloween, so it's ironic. She brought a candy, a Hershey candy from daycare to our house, and she knows better than that because she's been explained everything, and she says, "Can I have that?" And I said, "Absolutely not in my house."
Yeah.
And she said, and she threw it away right away, and I was like, well, I want her to have something. I want her to have something that would be good tasting and clean, and she can basically enjoy it.
Yeah.
And I was like, how is chocolate made? So I tried to replace that Hershey candy with trying to melt the Lind 100% chocolate, which is horrible tasting. It's just really bitter. There's no sweetener at all, but I wanted to sweeten it with something that was healthy. So I had no idea you're not supposed to put any kind of water-based syrup in the chocolate. I did it anyway. Yeah. So I melted that chocolate. I mixed it up with some syrup. I put it in the molds. Of course, it's all curled up, and it was horrible looking. But I made these little pineapples in the mold, and I was like, Dora, here you go. And she like took one little bite and she's like, she's like, nope, absolutely not. And I was like, well, that's not a deterrence. Let me figure this out. Right. But then I started asking, how is chocolate sweetened? And I realized that there are machines that essentially mix in the sugar as the chocolate ingredients being mixed together, so you can't sweeten it after the fact. Okay. That set me on a very untypical journey, but instead of learning from the books or the courses, we actually decided to go to Peru and Costa Rica and Bolivia, where people were making chocolate as a medicinal and ritualistic drink and food for hundreds, thousands of years, and learn from them. And so we went to like far remote villages, which you had to took a like a jeep to cross rivers and like completely no roads, off the beaten path. But we found those descendants of Mayans and Olmecs and Aztecs. And they were growing the chocolate, and they were fermenting the chocolate, and they were drying the chocolate, and they showed us how to make the chocolate in the field conditions. Wow. And they didn't use sugar. They used the plants that grow right there in the Mesoamerican region, which is agave, chicory, and stevia plant. And that's how they sweeten their cacao and, you know, rougher chocolate. And I was like, I can do this. I can figure this out at home. And after COVID, I decided to leave the biochemical, biomedical establishment and actually go into entrepreneurship. Yeah, I started
That's exciting.
2 companies. So Sinless Treats is one, and there we make and invent different metabolically healthy sweets that taste exactly like how a high-end sugary chocolate, but actually help people lower their blood sugar, reduce their risk of diabetes, cancer, help kids to enjoy chocolate without becoming hyper and overactive. And the second wing of that is I'm a partner in a company called Reva Green, and we make microgreen based dietary supplements. So we grow the microgreens on very special regenerative soils because what plants get from the soil, it makes available for us, for our health. And then the microgreens go into the chocolate. So the two companies are very happily married.
Yeah. I was going to ask you how you get all the ingredients, because I know you were telling me, you source them from different areas and different...
So we source them exactly the way that nature intended them. So the cacao beans we source from Ecuador. They're grown in regenerative agroforestry farms. So the farm really looks like a rainforest. And it's cacao trees just dispersed amongst all of these different native species. Nothing gets deforested. In fact, they seed the forest back up so they can grow those cacao trees in the shade in the proper region with the proper humidity. And it's really lovely, because a lot of toxins, first of all, you can't use any pesticides or herbicides on those cacao trees like the monocrop farms are doing. So there is no heavy metal contamination, which is a huge scandal since 2022, when that consumer report came out showing how much cadmium and lead are in different dark chocolates.
Oh, wow.
So we've tested twice, and we have no cadmium or lead, because when you have healthy soil, those microorganisms and other plants sequester it and don't let it get into like cacao and cacao trees. We get our inulin and stevia from organic farmers here in Texas, so they're local. And what we do is we freeze dry them in order to essentially as minimal affect them as possible. So retain all of the nutrients, polyphenols, flavonoids, everything that is good for our health, everything that makes our skin smooth, our nerves better insulated, feeds our brain, our gut microbiome. So sourcing is very, very important to us.
Yeah, it's pretty amazing. You got sourced from all over. It sounds like you've done a ton of research and found just the right people and the right farms and
We continuously learn. I continuously do research, because I continuously want to make sure that we adhere to science. And as we learn more, the science evolves. I want to make sure that we put the very best into our product, because I eat those.
Yeah.
My daughter, who's now 8, eat those. And everybody who loves and buys and tries Sinless Treats chocolate can have my promise that what you're eating, I'm eating on daily basis. And if that ever change, I'll close the company.
Well, that's a great promise that, you believe in it, and I know you put everything, your heart into it.
People ask me, how did you come up with all of those flavors? And I'm like, I made them for myself. I never intended this to be a company. It was only when people started calling me saying, oh, I'm diabetic, but eating your chocolate, I don't have the same symptoms that I usually get. And I would say, what kind of symptoms? And they say, well, I have tingling sensation and vertigo and a vision blurring temporarily, because they get the sugar and then they get insulin response that kind of drives that. Constantly people have told me that they do not have those symptoms. And when we ran clinical-like trials on 384 people, diabetics and non-diabetics, every single one had a few points reduction in their blood sugar eating our chocolate.
Actually making it better.
Yeah,
That's
actually
amazing.
making it better. Yeah. So we're about to start the second part of it, where people would eat something that really does spike them, and then follow that by eating chocolate. And we want to see if there is a mitigation of the sugar spike with the chocolate.
Oh yeah, that'll be really interesting. I'm interested to see.
I'm very
much
looking forward to it too.
Awesome. What is one thing that you would tell people if they want to start on this journey of trying to be healthier and cut the sugar, cut all the things that they need to minimize?
I would say start slowly. Do one step at a time for 3 weeks. So once that becomes the habit, do the next thing. The number one thing I would say, give up the sodas. Those are diabetic sugar water.
Yeah.
If you, that would be a great first step. It's very achievable. Once that is gone, you found something else to replace it with, like apple cider vinegar with seltzer water, for example. That's what I drink. It's great. Give up something else. Give up something, say, I'm not going to eat anything from the bag anymore. Try to find this enjoyment in preparing meals together with people you love. Maybe your kids, maybe your spouse, maybe your dog.
Right.
Who knows? Like, drop a little piece of meat.
Yeah.
So it can.
I love it.
Yeah, like we need to make positive emotions, associate different positive emotions with food, not just consuming food that's bad for us, but actually creating happiness and community around the foods that are good for us.
Yeah. I love that. That is great. I agree. So tell us where we can find Sinless Treats.
You can find us online at sinlesstreetschocolate.com, or if you're in Houston, you can find us right down the street from you. It's 5400 Bel Air Boulevard. It's the cross of Bel Air and Maple Ridge, directly across the street from Bel Air Triangle. So we always have plenty of samples. You can come in and try it before you buy it. Everything, you can verify that you will not be able to tell the difference.
I love it and love samples. That's awesome. So thank you for coming in. This was so wonderful. It was so great to talk with you again.
Thank you for having me.
And you can find me at www.drangelaSturm.com if you want to know more about medicine, plastic surgery, looking good, feeling good, being healthy. Follow us at Beauty Unveiled.